Welcome, family. In today's knowledge, let's talk about tips to stop febrile seizure, also known as convulsion, in a child. Watch till the end as I teach about the safety measures to help prevent further injury during the episode. Please subscribe if you haven't. Like and share. A febrile seizure is an episode of unconsciousness and violent bodily convulsion, usually accompanying a fever caused by a common childhood illness, such as a cold, flu, or ear infection. Children between the ages of 6 months and 5 years are most likely to experience febrile seizures, which typically occur at the onset of the fever. Witnessing your child experiencing such a seizure can be extremely agitating, but it is important for you to remain calm, and remember that most febrile seizures have no lasting negative effect on a child's health. Stay calm. Breathe deeply, and remember that, while your child's distress may be difficult to watch, the seizure should pose little threat to your child's long-term health if treated properly. Note the start time of the seizure. It is important for you to keep track of how long the seizure lasts so that you know whether emergency medical assistance is needed, and so you can accurately report the duration of the seizure to your child's doctor once the episode has subsided. Place your child on a safe, stable surface. The convulsions associated with a febrile seizure can cause your child to move about involuntarily, so you should make sure to place them away from any steep drop. If your child is already safe where they are, avoid moving them. Placing your child on the floor, or in the center of a bed are good options. If your child is still small enough, you may simply lay them on your lap, and support them with your hands. Ensure that the area surrounding your child is clear. If there are hard objects, such as furniture, in the vicinity, move them away from your child so that they don't accidentally strike them. Soothe your child, and make him comfortable. Remain calm, and remember that, while it is distressing to watch, your child's seizure will pass. Speak in soft, low tones to your child. This will help both of you calm down. Remind him, and yourself, that you are there to care for him, and that everything is going to be all right. If your child is laying on a hard surface, slide a blanket underneath him. Remove or loosen any clothing from the waist up, especially around the neck. Do not restrain your child. Simply ensure that he is safe, and allow the convulsions to pass. Turn your child onto his side or stomach to help him breathe. It is normal for a child to vomit or produce a lot of saliva during a seizure, and repositioning him will ensure that their breathing passages remain clear. Watch for breathing problems, including the child turning blue from a compromised airway. If this occurs, dial 911 immediately or your local emergency line. Avoid sticking anything in your child's mouth to clear his airways, as he may choke, or involuntarily bite down. Determine if emergency medical assistance is needed. If your child's seizure lasts longer than 5 minutes, or if your child does not regain consciousness quickly after his convulsions have ceased, you should call an ambulance before continuing treatment. Don't panic. Even febrile seizures severe enough to require emergency medical attention do not pose a serious threat to most children. If you do call for an ambulance, calmly relate to the operator that your child is having a febrile seizure. Tell them how long the seizure has lasted, and briefly describe your child's convulsions and state of consciousness. Know the difference between a complex and a simple febrile seizure. A complex febrile seizure lasts longer than 15 minutes and occurs multiple times in a 24-hour period. Monitor your child's level of consciousness. You should observe and soothe him constantly until your child returns to consciousness, or until emergency assistance arrives. Reducing the fever. Give your child acetaminophen or ibuprofen. If your child has already returned to consciousness, you may give him a normal oral dose. Closely follow the instructions on the medication package. If the seizure is continuing, do not attempt this, as your child will likely be unable to swallow properly. You may give an acetaminophen suppository, if you have one. Children 6 months old or younger should not be given ibuprofen, and no child should ever be given aspirin, for any reason. Apply a cool, wet cloth to your child's face and neck. This will help soothe the child and lower his body temperature. Bathe your child with lukewarm water. This will further relax your child, help relieve his fever, and make him more clean and comfortable. If the seizure is still in progress, use a sponge to bathe your child, rather than moving him to a bath. Do not bathe your child with cold water or rubbing alcohol. Lowering the body's temperature too quickly is dangerous and can induce shock. Provide fluids if possible. If the seizure is continuing, do not introduce anything to the child's mouth. Continue soothing your child and treating his fever while you await medical assistance. Allow the child to sleep. Once the seizure has ended, and you have taken steps to reduce his fever, make him comfortable in a cool room, and let him rest. Sleepiness is common after a seizure, and sleep will allow your child's body to begin working to lower his fever. While your child may feel chilly, don't bundle him up in too many blankets until his fever has broken. Remember that your primary goal once the seizure has ended is to gradually lower his body temperature. Continue monitoring your child. If his fever worsens, or he experiences more seizures, call for emergency medical assistance. Again, do not panic. Febrile seizures are dramatic and frightening, but even repeat episodes pose little threat to your child's long-term health, especially if you remain calm and focus on soothing him and lowering his fever. Consult your pediatrician. It is important to identify and treat the cause of the fever to prevent future seizures. Give your child's doctor a detailed description of the seizure, including symptoms, and the lengths of the episodes. Want to know more? Subscribe, like and share. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.